Greetings. My name is Thameena Khares, representing University of South Wales, Diploma in Diabetes Module 6. This discussion is about macrovascular complications related to diabetes. The aim of the presentation is for you to understand long-term complications of diabetes in order for you to foster early treatment and care. Thank you. Contents of the presentation will include chronic complications of macrovascular disease, brief epidemiology based on facts, atherosclerosis, risk factors of macrovascular complications, cardiovascular disease, stroke and peripheral vascular disease, facts on some clinical trial, and a lifestyle intervention. Atherosclerosis is the chronic inflammation of blood vessels to the coronary and peripheral vascular system. What happens is that there is an increased circulating lipids and glucose levels which result into arterial wall damage. This results to a cascade of reactions in the wall. First of all, there is low density lipoproteins and cholesterol accumulation. The process attracts white blood cells and macrophages to protect the endothelium that's damaged. This causes a stiffening over time, resulting into plaque of the blood vessel walls. And this also contributes to high blood pressure, which is also known as hypertension in most common diabetic patients. Below are examples of the macrovascular complications. We have the brain, cerebrovascular diseases, TIAs, cerebrovascular accidents. The heart has problems such as coronary artery disease, myocardial infarction, or congestive heart failure due to macrovascular complications. And in the lower extremities is the PVDs, peripheral vascular disease, that is the ulcerations, gangrenes, or amputations. So, some true facts are that cardiovascular disease is the leading cause of death, about 70% in people with type 2 diabetes. People with diabetes have a 5-fold greater risk for a first myocardial infarction. Stroke is the third leading cause of death in the USA after CVD and cancer. People with diabetes are 15 times more likely to have a lower extremity amputation due to macrovascular complications. These are just some of the many facts that are there. According to INSO, Atherosclerosis can develop from teenage years and may take about 40 years to develop due to lipid retention, oxidation, and inflammation. The process of plaque formation is the same regardless of your race, sex, or geographic location. Also, the rate in development is faster in people who have hypertension, who are smokers, diabetics, obesity, and genetic predisposition.
Millimoles per Hg reduces the risk of stroke up to 40%. So, hypertension or high blood pressure means that with each heartbeat, arteries in the body swell and stretch more than they normally do. This stretching of the arteries can injure the endothelium, causing arteries to stiffen, and that contributes to atherosclerosis. Lipidemia and macrovascular complications. How does cholesterol affect macrovascular complications? It is one of the risk factors actually. Dyslipidemia is prevalent in diabetics and thus recommend a lipid profile screening at the age of 35 to 40 years. LDL, which is the bad form of cholesterol, as it transports cholesterol to blood vessels, therefore attracting macrophages. Therefore, there is a need for statin use, which is aspirin, for diabetics as early as possible.
The picture shows a cardiovascular diseased heart, where we see the affected areas of the coronary arteries that are narrowed versus a normal coronary artery. You can see the cross section of the artery, one that is normal and the one that has a lot of plaque. Obviously this would affect with circulation and blood flow to the heart. Hyperglycemia appears to be a significant factor of stroke, that is, elevated blood levels of chronic inflammatory markers are associated with an increased risk for strokes in people with diabetes, according to Cade 2008. Strokes can be caused by ischemic blood supply stopped due to a clot formed or hemorrhagic reasons, that is, a weak blood vessel supplying blood to the brain bursts. Peripheral vascular disease is a blood circulation disorder that causes the blood vessels outside of your heart and brain to narrow, block, or spasm. This can happen in your arteries or veins. PVD typically causes pain and fatigue, often in your legs, and especially during exercise. In PVD, blood vessels become narrowed and blood flow decreases. This can be due to atherosclerosis or hardening of the arteries, or it can be caused by blood vessel spasms. In arteriosclerosis, plaque builds up in a vessel and limits the flow of blood and oxygen to your organs and limbs, as shown in the picture. As the plaque progresses, the second picture is an example of a completely block the artery. Not something anyone would wish for. This can lead to organ damage and loss of fingers, toes, or limbs if left untreated early.
So to conclude, let's look at changes in the lifestyle and how we can improve our health. Let's quit smoking. Smoking is a leading cause of most complications, heart attacks, strokes, and PVDs. Let's change our diet. Let's reduce our weight. Okay, for overweight patients, at least by 7%, and then slowly reducing it further. Carbohydrates monitoring. Increase fruit and fiber content in our diet. Yes. Use low-fat milk. Reduce our salt intake in our food. Okay. Fat and cholesterol should be reduced further on. Let's increase our physical exercise at least 150 minutes per week. Strict sugar control and reduce our alcohol intake. Strict blood pressure control. Cholesterol control. Aspirin therapy for patients above 30 years who are suffering, who are diabetic patients, obviously. Regular peripheral assessments for diabetic patients, that is, wear well-fitted shoes, frequent self-foot examinations, minimize traumas. Early detection is very important to prevent ulcers. Provide support and early antibiotic therapies for foot ulcers in diabetic patients. Lipidemia and macrovascular complications. How does cholesterol affect macrovascular complications? It is one of the risk factors actually. Dyslipidemia is prevalent in diabetics and thus recommend a lipid profile screening at the age of 35 to 40 years. LDL, which is the bad form of cholesterol, as it transports cholesterol to blood vessels, therefore attracting macrophages. Therefore, there is a need for statin use, which is aspirin, for diabetics as early as possible.